Lovely. Right, chaps, we're under time pressure, so let's kick off. Right, hello everyone. Welcome to this session. Just a quick So, yeah, I'll do the housekeeping first. First of all, obviously, just if everybody could shut their phones off or put it to silent or airplane mode, that would be great to start off with. Also, if you can feed in your questions here, all the information's there. That would be helpful. You don't have to do it, but that would just be really helpful for us because we can have the questions up here, and that will slightly prepare us for the Q&A that will come afterwards. I'm Nick Tyrone. I am a RADIX fellow and a Spectator columnist, and our session today is about what are the health inequalities in left-behind communities and how can we level up. So obviously during the COVID crisis, what we found out when the NHS was under pressure was how much health inequality we had in the country. Obviously the burden tended to fall higher on people lower down the socioeconomic ladder. So what we want to do is try and discuss those. What has the pandemic laid bare in terms of that, and how can we improve on those things? Now, to start us off with, we've got a video from Professor Sir Michael Marmot from the UCL Institute for Health Equality. So he's kindly given us a video on the subject that we're going to watch.
On the 30th of June, the front page of The Guardian had two stories. And a friend of mine in the United States, in Washington, D.C., wrote to me and he said both stories were jaw-dropping. The one that covered 2/3 of the page was England 2, Germany 0. And the bottom third of the page was quoting me saying the drop in life expectancy in Greater Manchester in 2020 was jaw-dropping. 1.6 years for men, 1.2 years for women. That is jaw-dropping in 1 year. 1 year may not sound like a lot. 1 year is enormous. And to get a drop of 1.6 years for men, 1.2 years for women, is indeed, forgive the cliche, jaw-dropping. We also reported that the COVID-19 mortality in Greater Manchester was 25% higher than the English average. And it illustrated what was clear from the beginning of the pandemic, that it would expose the underlying inequalities in society and amplify them. And so it proved, not just in Greater Manchester, but all around the country. I've been emphasizing the so-called social gradient in health for a very long time, pre-COVID. If you look at where people live and classify it by level of deprivation, the greater the level of deprivation, the shorter the life expectancy. It's a graded relation from top to bottom. When we look at COVID-19 mortality, the social gradient in mortality from COVID-19, whether in Greater Manchester, the Northwest, or the country as a whole, looked almost exactly the same as the social gradient in all-cause mortality. In other words, although we think of COVID as being about a virus and the vaccine will solve it, it's much more about the nature of society. The causes of inequalities in COVID-19 mortality are really pretty similar to the causes of inequalities in health more generally. And that's why where we were before the pandemic is vital and of importance. I produced a report on the 25th of February, 2020, the Marmot Review, 10 years on. We look back at what had happened in the 10 years since I produced the Marmot Review, Fair Society, Healthy Lives. And the picture wasn't good. A slowdown, a marked slowdown in improvement in life expectancy, increase in inequalities, And life expectancy for the poorest 10% outside London actually going down, getting worse. The bottom 10% had got sicker over the decade from 2010 on. A miserable picture. And COVID-19 made it worse. And that's why the report that I produced in December 2020, we called Build Back Fairer. And the report for Greater Manchester, we called Build Back Fairer in Greater Manchester. If the government is serious about levelling up, let's pause on that conditional. If the government is serious about levelling up, then our Build Back Fairer reports, the national one produced in December, and the one that underpinned England 2, Germany 0, physically on the page, if not conceptually, give the blueprint of what needs to be done to build back fairer. We don't want to go back to the status quo that existed pre-pandemic. As I documented in my 10 years on report, that was far from ideal. If we're serious about levelling up, that means building back fairer. My recommendations look at early child development, education, employment and working conditions, having enough money to live on, healthy and sustainable places in which to live and work, and taking a social determinants approach to prevention. But at a higher level, and so we need action on all of those, but at a higher level, we need to put equity of health and well-being at the heart of all government policy.
Right, I am now going to turn to Dolly Theis, who is the co-founder of the 50/50 Parliament, hashtag Ask Her to Stand, and a health campaigner. And Dolly, what's your take on the health inequalities that the COVID crisis has uncovered, and what do we do about it?
Well, thank you so much, and thank you for having me speak in this session. I want to pick on two things that Professor Sir Michael Marmot touched upon, which is action and the tackling it from a social determinants, health inequality perspective. And I conducted a piece of analysis last year that was published in January that was a 30-year analysis of all government obesity policies, called obesity policies, but broadly health, diet, physical activity, planning policies, school food, you name it. It's all included within the broader remit of obesity policy. And the stark findings were that there have been 689 policies proposed by government in that time. So 30 years, almost 700 policies proposed in that time. And yet we haven't seen a significant or consistent reduction in obesity prevalence or the related inequalities. So why is that? We wanted to explore that. And we did that through understanding what kind of policies have been proposed, what are those almost 700 policy proposals, and why hasn't actually translated into any meaningful results. And there are lots of reasons why, but two, which one relates to the inequalities point and one relates to the action point that Professor Sir Michael Marmot touched upon. The inequality is that the types of policies that tend to be proposed are less likely to lead to reductions in the inequalities because they rely on people to use a lot of their own resource in order for them to make a difference. So policies like information-based things, you can do that if you've got the time, resource, if you're willing to engage, if you're interested in it. But if you've got a busy, stressful life, and life is hard, we've got a lot on our plates already, without having to think and engage with the kind of information of, whether it's dietary advice or whatever, we've got a lot on, it should be easy. So those have been the majority of policies proposed by government have relied upon people having to really expend a lot of their resources, whether that's time, money, engagement, you name it. And that gets harder when you're in more deprived areas facing disproportionate barriers The other thing on the action front, or why we haven't seen that probably likely led to meaningful action, is because policies have largely been proposed in a way that's unlikely to lead to them being implemented. So what we also saw over the 30 years was repeated policy ideas, again and again, the same thing you would see. And why did they not happen? Because 91% of those almost 700 policies were proposed with no cost or budget. 76% had no monitoring and evaluation plan. Barely half of them even had a responsible actor in which was responsible for actually implementing the policy. These vital pieces of information that actually makes these ideas turn into action was missing. So no wonder we've got a situation of 30 years of policies, and people like Professor Sir Michael Marmot, who have published reviews with great recommendations built on the evidence, that 10 years later he's having to publish updates on it's actually worse. Not only have we not seen the situation solved, it's actually worse than it was 10 years ago. So those are my two pieces on the action and inequalities side of things.
Wonderful. Thank you, Dolly. I will turn now to Dev Sharma, who is the co-chair of Bite Back 2030's Youth Board. He campaigns on a load of issues, and he's a MYP for Leicester. And Dev, what's your take on this?
Thank you so much. Good afternoon, everyone. I think it's afternoon. Thank you so much. It's an honor to be here. Coventry is an amazing city. So I'm the co-chair of the Bite Back 2030 Youth Board. And Bite Back is a youth-led campaign which aims to revolutionize the high street. We've realized that in terms of health and everything that Dolly said and the professor said, in terms of health and children's health in total, in general, adults for generations have spoken about young people, yet we haven't really heard young people speak about their own health. I think the aim of Bite Back and the reason why we created it was we said nothing about us without us. I think one of some of the health inequalities that have been exacerbated over COVID and over the lockdown was advertising, and young people and Bite Back as our campaign saw that massively. So young people were doing online school. Everyone was living digital lives. We were, talking to our friends online. We were interacting online. We were living digital lives. What we basically saw happen was an exponential rise in advertising for junk food advertising. And it was incredible. So something that Bite Back did, we actually led a campaign on trying to restrict junk food advertising online. And we saw this issue, and a lot of the young people on our youth board saw this issue and said, okay, we're seeing a rise in junk food advertising. We're finishing school. My schoolwork is set online. The website that my teachers told me to do the schoolwork on is flooded with advertising. So when I'm finishing my schoolwork, all I'm seeing is an advert for a Mackey's. So I'm craving a Mackey's after a long day worth of work. What can we do about it? So we delved into the government's own consultation, into the government's own statistics about junk food advertising, and saw, is this actually an issue? Does this actually impact young people? Does it actually affect young people? And in 2019, and this is before the pandemic, young people saw over 15 billion, and that's billion, that's junk food ads in 2019. Now that's 400 adverts per second for junk food. And that's incredible. That's when we kind of realized, and this is in the middle of a pandemic, we realized around February time, that we live in the UK and we think that our internet is regulated, but we live in the country with one of the most vast, most unregulated internets in the world in terms of advertising. And I think that really sheds light on health inequalities exacerbated. These massive, massive companies have billions and billions of pounds who are responsible for tons of amount of global consumption. They are responsible for an incredible amount of global consumption in terms of food. These companies spend billions to advertise unhealthy food to young people. And that's only gotten worse over lockdown. I'll move to the successes, and one of the successes we saw from that was, Bite Back campaign on this. I wrote an open letter to Matt Hancock calling for the health secretary, calling for a complete end to junk food advertising. We also did we hired an independent expert to try and see if our suspicions were correct. We saw that junk food advertising had actually increased over lockdown. that nearly half of all child UK influencers had advertised junk food, and that if we introduce a junk food advertising ban, that would add an approximate 125,000 extra years to the lives of British children. Now that's incredible. And I think there's still so much work to be done. There's so much things that's like our high street is flooded. We realized that these massive companies have so much control over our lives. We saw that digitally. Still so much to be done. But a win that we've had recently is in terms of junk food and advertising and how that controls us. And hopefully onto bigger and better things to protecting children's health. Thank you.
Great, thanks, Dan. Well, I'll come now to Councillor Rosemary Sexton. She is a Green Councillor, sorry, in exactly one day. Not yet. In Solihull, and is the health spokesman there as well. So over to you.
Brilliant. Thank you very much. And thank you to the previous speakers for the great contributions and the really important points you've raised. Sir Michael is a bit of a hero of mine. And one of the first things I did when I took over as health spokesperson for our group in Solihull was to read one of his books. And the reason for that is because Solihull has a really big problem with health inequality. The difference in life expectancy between Kingshurst in the north of Solihull and Knowle in the south is 12 years. 12 years. Now, just to put that into context, if you could completely cure heart disease, it's gone completely, the increase in life expectancy we get from that would be less than half of that. So 12 years is absolutely massive. Now, one of the things I wanted to understand was why we see this difference, why we see this huge difference. And we see it across economic lines, also across other inequalities, things like racism. We see that difference in life expectancy there as well. And when I start talking about this, a lot of the time, what I'll hear back from people is, yes, but it's about people's choices. It's about the choices people make. People choose what they eat or whether to exercise. And if only poor people would behave a bit better, if only they would eat better, if they'd smoke fewer cigarettes, if they'd do more exercise, then they'd stop dying on us. You know, we've got programs for this. We've got educational programs. We've got policies in place. Why won't they get on board? And I've heard people say, you can lead a horse to water, but you can't make them drink. To which my response is, you can lead a politician to data, but you can't make them think. And there's a lot of data out there around this, and there's a lot of data that says this is not a problem that's going to be solved by behaviour. This is not a problem that's going to be solved by more education, as I think we've heard. And unfortunately, for looking at individual problems like the problem of obesity, this isn't something that individual policies are going to be able to tackle very easily, because health inequalities are fundamental. And it's very, very hard to address health inequalities without addressing inequality. And that's the thing that sometimes people don't want to hear. So let's talk about why inequalities lead to a health gap. The first one of these is because poverty is inherently stressful. When you're worrying about how to pay the bills, how to keep a roof over your head, you know, where the next paycheck is coming from, that's a stressful place to be. When things go wrong, you don't have the means to buy your way out of a problem. When your washing machine breaks unexpectedly, you don't have the spare cash just to go out and buy another one. And then there's the problem of social status, because one of the things that we know is that for primates, and not just for humans, we know that in our closest primate relatives, social status is inherently, being at the bottom of a social hierarchy is very stressful, and that stress will kill you. Like I said, this is, you know, when we talk about baboons, for example, and there's a great behavioural biologist who's written about his time studying baboons in East Africa, Robert Sapolsky. I highly recommend his books. And he's talked about the effect of being at the bottom of a status hierarchy for baboons. These are not animals who need to eat less junk food or smoke fewer cigarettes. these are animals who are affected just by that social interaction that's going on. And being poor is absolutely the same as being at the bottom of that status hierarchy. The next reason is because poverty reduces autonomy, so it makes it harder to make choices about your life. And people in stressful situations who've got lots to think about will tend to default to easy choices, or the choices that come most naturally. Unfortunately, in our society, we have industries that are centred around making unhealthy choices easy for people. The junk food industry, as we've heard, it's easier to be inactive. It's easier to reach for something out of a vending machine rather than a salad. And that, again, makes it harder for people. The harder your life is, the less likely you are, the less able you are to make those better choices. And the third reason that I want to talk about today is to do with access to health services, because access to health services and your experience of health services will be affected by your status and the amount of money that you have. When we talk about, for example, the willingness of people to go and get COVID vaccines, a lot of the time, the rate of vaccination will track very well the levels of inequalities in society. And part of that is to do with people's trust in the system. So if you're poor, you're likely to have had worse experiences of healthcare in the past. You're less likely to trust the system. You're less likely to get on board with programs like vaccination and other health programs. So more programs is not the answer. We've got to address some of these root causes. And this is why it's a really difficult problem. And it's why it's very hard to find ways to address this that don't just tinker around the edges. Now, that's not to say that these other policies are not important, because I think they absolutely are. The LGA, for example, has called for the government in its health and care bill, when it's talking about obesity, to restrict junk food advertising much more extensively than it has done, particularly around schools, for example, to tie in with that point earlier. Again, they haven't yet been persuaded to do so. So these are things that we can and should be addressing. But we also need to look more broadly. We need to look at how to make healthy choices the easy choices for people, so that they're accessible to more people. And we need to look at how to address those fundamental inequalities, rather than just trying to educate people around it. I'll stop there.
Thank you very much. Right, so we've got a question from the crowd. Mark Essex. This is directed at you, Dolly, but if other, so I'll let you have first crack at it. But if other panelists have strong views, please let me know. So basically, taking your quote, people are busy, they don't need more info. Agree with that, but the problem being is, if we sort of try and tailor advice to need, how do we get around postcode lottery? And obviously, if the whole point where we're trying to get around here is health inequality, how do we avoid just making the health inequality different, if you like? We still have the inequality, but just in a slightly different way.
So, I mean, it's a very interesting point, and it comes down to about the kind of information that we're talking about. So, I mean, come into this conversation, Mark, because and do explain a bit further in terms of when you're talking about the types of information, do you mean in relation to what I said about what information based policies are proposed, or?
It was when you said that what we don't need much more information. I sort of agree, right?
Yeah.
So how do you reduce the amount of information? You make people do their own research. You tailor it, you curate it, you say, you're this sort of, and that's why we have a GP who figures out what's wrong with you. So, but if you tailor it, then you're giving different people a different set of advice messages, maybe even a different deal. And is that okay?
I mean, there are so many different types of information that we can be providing. You're talking about healthcare, within the healthcare space, and health professionals giving advice, whether that's, what you can be doing to change things in your own. Those sorts of things we know are less likely to be equitable and effective, because they rely, again, on a person to come away from having heard that advice. And we talked about this earlier. People know what they need to do to live a healthy. Everyone can sort of broadly label what's required in order to live a healthy life. That's not necessarily the barriers. And we, again, had this on both of what you were talking about. And it's an important reminder on some of the things that we have been discussing earlier today, which there seems to be a resounding theme, which is that people want the positive. arguments as well. They want to know what it looks like in a world where it is easier. And it's not just about ease, it's about it being appealing. It's about it being aspirational. It's about it being socially normal. You know, all of these things. And we talked about it is easier with with the cooking, and it can be cheaper and whatever in reality. But what are the other barriers that are contributing to that not actually happening? And social norms and branding and what is available around us, all of these things interact, which again comes to your point on why this is such a complex area, because you're not likely to see one policy make a drastic difference to the outcome. You're going to need multiple policies where each one is playing a role. And tobacco reduction is a really good example of where multiple policies made that happen over time. Each one, if you just did plain packaging, if you just did banning and smoking in public places or whatever, all of those things alone will not have contributed to the downward trend. We need your idea combined with junk food advertising, combined with high streets and tackling the social determinants in terms of poverty. Each one needs to be understood as that. And I hope that we can create a condition where it's not zero sum. We're not saying that one or that policy idea. How can we say when the government is doing advertising, that is amazing. Let's see how it works in practice. What are we going to do next? How are we going to get the LGA's recommendations into practice, et cetera, et cetera? This is going to be continuous, and we want it to be positive. We want cooking to be cool, healthy to be delicious, nutritious. We need to see it and imagine it and see other people that we are exposed to doing those things as well.
Wonderful. I'm going to go to... Oh, do you want to come in?
Can I just quickly
Please,
come in?
yeah, go on.
One of the things that we like to talk about in public health is a concept called proportionate universalism.
Yes.
So the idea with that is that you make a service, or you make something universally accessible so that everyone use it, but you target it towards areas and towards people where that need is greater. So you might look at basing it in a particular area, for example, where you think that that's going to have the greatest impact. And again, the idea with this is not that you're keeping people out. I mean, you do want to make sure that you're getting it to the people who need it most, but you're not saying you can't come. You're just putting that in a way that's going to target the right areas or the right demographics.
Great, thanks. So I'm going to go to Tim. You had a question.
So I just wanted to develop this idea a little bit, because I'm not sure if the panel necessarily responded to the implication of Mark's question, which is that we can follow a lot of what is now on offer in terms of technologies that are available, personal research that Mark discussed, and we could do a huge amount to raise average life expectancy. But we would be doing that by increasing the inequality, because the responses to the additional technologies, the ability to inform yourself, the ability to access early diagnostics, the ability to access vaccines, etc., could have a collective positive effect on the population. But actually, the very people who, somewhat patronising, might need it most are the ones who are least likely to respond to it. So are we comfortable with a world in which the collective good is improved, but the inequality increases, as opposed to simple universal measures such as the time come to ban smoking?
So my take on this is that you have to do both. We want to look at how you can increase average life expectancy across the board, and there's going to be a demand for that. You know, I think every politician is going to want to look at increasing that baseline. But you've also got to look at what are the barriers to access and how can we make that more equitable and how can we address those particular barriers. And I think those conversations are really important. And it feels like we're just starting to get to a place where those conversations are happening. And when we talk about these things, I mean, I sit on our Health Scrutiny Committee, I sit on our Health and Wellbeing Board, I sit on the LGA's Community Wellbeing Board, and those conversations are happening. You know, when we talk about something that's coming in place or a change in systems or a change in how health services are accessed, one of the things that I will always bring up is what effect does this have on certain marginalised groups? You know, what effect does this have on people who may be less able to access the internet? What effect does it have on people who don't have access to a car? You know, and those are, I think, are really important to consider. And that's the purpose of some of these these boards. We've got to look at that at a local level as well. It's not something that, you know, there's a one-size-fits-all approach to. You've got to engage with those communities, and as Deb very rightly said, you know, you've got to do it with people, not to people.
Okay. Thank you. Yes, question there.
It's interesting listening. We're talking about, it's funny because I was listening to the gentleman when I left here, and with no disrespect to anyone else, just, you know, it's the most insightful. This is someone speaking from an area where actually these propositions you seem to have a lived experience of this. The problem we have personally is that we're talking about this when these aren't our problems, and I don't mean that in any kind of disrespectful way. When we're talking about the possible solution for these people, when we've got, I mean, it's difficult because of course we all have you know, we're all speaking of the best will in the world, but it seems to me we're talking in a way which actually doesn't address problems. We might diagnose them. We might be wrong. We might be right. We might be wrong. And yet, the positive here is this gentleman. I'm not trying to point out. You know, everyone's spoken so well, and this gentleman here is the person with the lived experience. Surely that's the answer. We're looking for answers here. Kind of got which, without, you know, any disrespect. I suppose that's my only observation. It's an observation of a question of how many years or so.
All right. Any other question? Or do you want to come in on that,
I'd
Dev?
love to comment on that. I couldn't agree more. I think, like in this argument, there's always a public health argument. There's always adults saying, "Oh, there's this and that." But do we really listen to the people with the lived experience? We saw that with free school meals. Do we listen to the young people with the lived experience? Young people have, for generations, for the last 30 years, especially the last 10 years, grown up living in an incredibly skewed food environment. They know firsthand how big companies target them. It's become a way of life. We're not really fazed by it anymore because, well, we are, but it's all subconscious. There's so much around us and it's so bombarded on us. We just kind of take it as an everyday thing. I'll give you a really good example where young people weren't listened to. And that was, I'm going to bring it back to junk food advertising. The government put out a consultation for junk food advertising, and they were like, we want to do this, but let's ask the general public what they think about junk food advertising. That's great. The consultation was designed for academics and big businesses to answer. When young people from Bite Back tried to answer the consultation, we just didn't understand the questions. Now, if you're trying to like introduce a policy, right, you need to listen to the people with the lived experience, yet that wasn't done. And that's what we need to see. We need to see a complete overall. We need to see from the highest levels of government to local authorities to businesses, listening to young people, working with young people. I also wanted to comment on a quick thing, and I think the lady mentioned an incredible, like, completely agree with her point. We need to move away from individual responsibility, right? Young people are growing up in a food environment which is completely different to what my dad grew up in 30 years ago. They grow up in a food environment where as soon as I come out of school, and I'll give a personal example because it's so obvious. I'm in year 11, I've just done my GCSEs, I'd have long school days and I'd be so tired. Walk out my school gate and I see a flashing, like, great marketing, bright chicken shop right in front of me. Then there's a fast food shop just behind my school. Now, I'm a young person, and that's literally the only option I see as soon as I come out of school. Now, that's convenient, because it's right next to my house, it's right next to my school. It's cheap, because I'm a young person, I'm not carrying tenors. I have £1 or £2. Like, my mom's not expecting me to go out and get a 3-course meal. I have £1 to get a burger. And thirdly, the marketing is so on fleek, like bright red, it's attractive. And how are you expecting young people to not go for that? So we need to change our surroundings. We need to copy what we've done with climate change, right? Climate change, so what we've seen is companies take we need to see a societal change. We need to see our big companies change. We need to see governments change. we can't pin it down on individuals to make the change when the individuals are growing up in an incredibly skewed food environment compared to what their parents grew up in. It's not easy to make a good choice. It's not easy to make a healthy choice at all for a young person. Before I just finish this point, the Food Foundation recently took out a report, and they mentioned a really astonishing thing. And this is about like growing up in a disadvantaged background. If you are in general, if you walk down your high street, 1 in every 4 shops is a junk food outlet. If you live in a low-income or a disadvantaged community, 1 in every 3 food outlet is a junk food outlet. Now, we've seen, because if you live in one of the most, so they also did research and they looked at the most affluent constituencies and the most affluent areas. And in the most affluent areas, 1 in every 5 food outlet is a junk food outlet. Now that clearly shows that the discrepancies and the inequality is there. If you grow up in a disadvantaged community, you're more likely to have healthy options in front of you. It's harder to find healthy options. And therefore, you're going to grow up eating food that isn't good for you, food that young people shouldn't be having. And that's what we need to change. I think that's why we're all here to talk about solutions. So I'll stop speaking and we'll listen to other members of the audience.
Thanks, Dev.
Just quickly,
Yeah?
just say, in response to the original point, I completely agree with you. I think the way I see it is my role is to create space for the voices of people who may not otherwise have their voices heard by those decision makers. You know, as a councillor, I get to speak to people who are involved in shaping some of these policies, who are decision makers. I can go and talk to them. You know, somebody who's maybe living that experience may not have that opportunity. But I can take those points with me. I can create space for them. I can try and make consultations actually meaningful rather than just the box-ticking exercises that they sometimes are. So completely agree that that's what we should be doing.
Right. Is there any more questions? Yes, this gentleman right here.
Thank you. So I think it's really, really fascinating to listen to you, and I think that you're crying out for people for if you like, the top-down solutions, and absolutely that's what politicians have to deal with. But at the same time, in terms of that idea of people being at the bottom of the pile and therefore that being a stressor, to use an overused phrase, some of that is about taking back control, isn't it? And when people feel in control of their lives, that's a way of addressing that. So my question is, and there's actually 3 of us here who are councillors. So as a councillor, my question is, are there good examples, are there good case studies of communities beginning to take back control of these health inequality issues that we can learn from and that we can try and spread good practice into communities from?
It's a good question. Does anyone on the... Yeah?
We were talking about the school food, but the Chefs in Schools project, for example, and what you guys are doing as well.
I had something in mind, and it probably isn't local communities, but let's look at London and the city mayor in London. I'm from Leicester, so speaking from a complete outsider point of view, they banned and restricted junk food advertising 400 meters near any school. They restricted junk food advertising on TfL. That's communities, that's local council taking back control. And what we saw from that was that more healthy options, the advertising that was in front of schools and that was available, because most schools are flooded with advertising. There's just bus stops and it's advertising everywhere when you walk out of school. Those options and those advertising options were replaced with more healthier food choices. And what we saw is when young people were presented with more healthier food options, they were going for the more healthier option. They wanted to have it more because young people are young, we're malleable. If you grow up seeing something, you're more likely going to want to have it, right? So that's probably something I've seen, probably local community. London's quite a vast city, so it's probably not local.
Well, that actually brings up an interesting question to me, which is, it kind of covers a lot of the policy stuff in almost any area, which is, if we're talking about things like, the problem with advertising, that sort of thing, all the stuff that you're talking about, Dev, how much of this needs to be top-down, as in this needs to be the national government doing stuff, and then how much of this needs to be local. And of course, the worry about the local stuff is the whole postcode lottery thing. We got into it about, you know, information and everything on Mark's point, but actually it's a more general thing of how much does the national government need to do, and how much is this going to be, or is this going to be powered by localism? Basically, is my question.
I think it has to be some and some, because I think you have to have an environment where you can do those things. You know, things like restrictions on advertising, for example. That's not something that you can just pull out of your hat. You need a framework that enables you to introduce that. But at the same time, I think you have to bring people with you. You know, I don't think it's something that will work well if it's imposed from above. It's something that people need to collaborate on. And I think the other really important thing is we've talked a lot about restricting junk food advertising and having less junk food available, and that's important. But there needs to be an alternative. And when we start talking about alternatives, what are the barriers to access for people to cook more healthily themselves? You know, if somebody, for example, doesn't have the facilities to cook at home, or can't afford the gas, or you know, doesn't have a saucepan, you know, things like that, that makes it much harder for them to eat healthily. So all the advice about healthy eating in the world is not going to help them to overcome those barriers. So I think it's about looking locally at, you know, where are the barriers here, and how can we address those? And I think that's something that that does need to be a local solution.
I agree. Look with climate change, right? The government is like, there's a top-down approach, but there's also local authorities doing work. The government can impose so much. The government can say, we want to do this by 2030, we want to do this by 2050. But then there's also local councils doing their part, and they're also taking out policies, and they're also working on this and creating more parks and creating more green spaces and cycle lanes. It's both approach. There's also stuff that I think I'm a firm believer in a top-down approach, but there's also work like Bite Back, the charity, our charity. We, over lockdown, created videos, and we work along, our campaign is actually funded by Jamie Oliver. So we found a chef from the Jamie Oliver School, and we created recipe packs, and we created videos alongside them for low-income communities, for kids on free school meals, to have to create, you know, to have their £15 allowance, to go to the supermarket with this checklist and cook a healthy lunch with Jack, and Jack was a chef, every single day. That was something we as a charity did. That's something, you know, like local. There's also stuff that the government can be doing. There's also stuff that local authorities can be doing. There's also stuff that charities and us, like volunteers, could be doing.
Right. I've got, there was a couple questions. There was one, yeah, there was a gentleman in the second row, a gentleman in the third row. So I'll take the gentleman in the second row first.
I was just going to add a couple of examples. I work at Bite Back as well, and I think at national level, obviously on advertising, there's stuff that government can enforce digitally and on TV, but at local, you know, there are things they can't. So street advertising at local level, Bristol local authority, I think, has now said it's going to stop any HFSS advertising on any billboards. And then there's other examples of local councils that have stopped planning permission for new sort of unhealthy food outlets near schools. So I think those are just a couple of examples of things that we've seen.
And yesterday, actually, Dr. Nick Johnson, who's just recently been elected as Mayor of Cambridgeshire and Peterborough, has committed to putting public health at the heart of his entire vision for that area. And it is a real kind of petri dish in terms of a sort of mini version of the UK. And that is very exciting. So maybe that's a watch this space when it comes to transforming that. But I would just echo what everyone said, that it's not zero sum with any of this area. At no point, if there's a concentration from top down, it doesn't mean that's not happening or shouldn't be happening elsewhere. And we just need to be continually remembering to celebrate the action that's happening across every level of government.
I think there are a lot of overlaps actually between when we're talking about health inequalities and when we're talking about climate change, because a lot of the same things apply. You need the local initiatives, you need a national framework that enables you to implement that.
Yeah.
Wonderful. Yes.
On that comparison, do you have the support for it due to climate change and on the topic? Is it as big an issue in the national consciousness?
I think there is a lot of misunderstanding around health inequalities, as I alluded to at the beginning, when I talk to people about health inequalities, a lot of the time we have to get past that stage where people say, well, it's about choices, isn't it? And I think getting people to the point where they understand that actually it's about an environment, it's about systems, it's about structures. And I think once you get to that point, actually you can bring people along with you. Something that I've noticed is that more and more we seem to be building some cross-party support on this, but it is something that we need to keep pushing on. And again, I think there's always that tendency to introduce sort of regulations and programs about individual areas, rather than looking at the big picture and saying, actually, the elephant in the room here is inequality, and how do we tackle that?
Isn't the challenge then that it's too complex to respond? The climate change argument is really simple and easy to make, but making that case takes 2 minutes and you have to go into detail. It's too complex.
I mean, as somebody who does make the climate argument as well, I think it's maybe not as simple as that. But I think I take your point that sometimes the more you have to explain, the fewer people you bring with you. So I agree. We need to find simple ways of getting these messages out there. What I'm tending to find is that in the meetings that I've been in, I've sat on boards and I've been there for a couple of years now, and we've had those same conversations time and time and time again. I've brought up those same points, and we're starting to get there. But it takes time. It takes time. And I agree that in terms of sort of the national picture and what the average person in the street might pick up, because the average person in the street is busy, they've got lots of things to think about. It's not that people can't grasp this stuff, it's that a lot of the time they haven't thought about it because they've got so many other things to think about. And I think that is a challenge. That's definitely a challenge.
Okay, we'll take, if it can be brief, because we're right out of time, so.
Just one question. So the topic is about protecting young people from violence. One of the things is getting popular is sometimes bullying can happen in social media and in daily life in secondary school. So, what do you guys think of this bullying and how to protect young people from bullying, or how to recover from this?
Anybody on the panel, briefly, on that?
So, sorry, I missed the end part.
Sorry. I was trying to say because recently, with the use of social media, sometimes bullying can also happen on social media, and which is kind of impact young people's mental health. So, for the health of the future generation, what would be the best thing to do?
Bullying on social media.
I think.
Do you want to take that one on?
Yeah, that's a big subject to launch into in the last minute of us.
Just 1 minute.
I think with 1 minute to go, I think we'll just leave that as if you want to pick that up with anybody afterwards.
Yeah.
Thank you everybody for coming. I thought this was a great chat, and as we showed at the end, obviously we could have gone on longer, but we've got the time that we've got. If everyone could give a huge round of applause, Councillor Rosemary, Sexton, Dolly, Theis, Sharma. Thank you everybody for coming.
And just before you go, that's the end of our programme. I wanted to just add my thanks to Nick and Rosie and Dolly and Deb. That was really, really great discussion. And I've had the opportunity, other than when I was chairing myself, to go through all of the sessions. And there has been the most amazing quality of debate. And it's come in part from the speakers we've put together, but much more from the participants with some just great contributions. And I've really enjoyed the discussion. And that's what Big Tent is all about. It's an opportunity to bring people together to discuss new, exciting political ideas, but not in a political environment where people, I hope, feel free to sort of abandon party labels at the door if they have them, and just talk openly and honestly. And just one thing that really struck me, I was talking last night with one of the MPs who's been here, and she was saying to me that in the old days, by which she meant 5 years ago, we used to, as politicians, to have the opportunity for those sorts of discussion. We went on foreign trips, and what happens in Vegas stays in Vegas. When you're abroad, MPs from different parties used to talk to each other. And that hasn't happened. It didn't happen first because there were 3 general elections in a very short period, and then because of COVID. And they've stopped talking cross-party. And that in itself has really strengthen or reinforce the divides that we see. Big Tent is our attempt to begin to get people talking together, both intra-politician and with politicians and outside the party level. If you've enjoyed today, tell your friends. If you haven't, then keep it yourself. If you have enjoyed today and you think that Big Tent should continue and do more of this, then please do check out our website, www.bigtent.org.uk, nice easy one to remember, bigtent.org.uk, and become a friend and subscribe. And you will hear about more of our events. We have the most exciting program which we're putting together for the next 3 years, including a follow-up to this event, which will involve coming back to Coventry. It will also include the report from RADIX, which is the think tank I run, and which will sum up the best ideas to come out today, and we'll look forward to sharing that with you. So with that, my biggest thank you is to you for coming. Please step outside, enjoy the sun, enjoy the booze, and have a lovely chat.